Every year, millions of seniors go in for routine checkups, thinking they're doing the right thing. Pause. But what if I told you some of these very tests might actually raise your risk of stroke overnight? Pause. I know it sounds hard to believe. You trust your doctor. You follow the guidelines. You do your part. But buried deep in the fine print of modern medicine are hidden risks that brochures don't mention, the news won't report, and even your doctor may overlook. Now imagine this. You walk out of your annual checkup feeling fine, only to experience blurred vision, dizziness, or worse just days later, and you're left wondering, what just happened? Here's the truth. Some diagnostic tests, especially when done too often or under certain conditions, can quietly raise blood pressure, disrupt blood flow, and set off a chain reaction that could end in a stroke. But don't worry, this video is not meant to scare you. It's meant to inform you, so you can ask better questions, protect yourself, and make informed decisions. Because after 60, it's not just about detecting problems, it's about avoiding the ones we might accidentally cause. So let's uncover the 5 most common tests that may quietly increase your stroke risk, and how you can protect yourself starting today. If you're over 60, drop a 1 in the comments. If not, drop a 0 and make sure to subscribe to Mindova, where we uncover what others don't. Section 1. CT scans with contrast. Let's start with a test many seniors have had. The CT scan with contrast. You may remember that warm, flushed feeling after the injection. That's the contrast dye at work. It helps doctors get clearer images of your blood vessels and organs. Sounds helpful, right? But here's what most seniors are never told. That injection can quietly stress your cardiovascular system. If you have high blood pressure, heart disease, or kidney issues, that contrast dye can trigger sudden spikes or drops in blood pressure, even fainting, nausea, or heart rhythm changes. In some cases, the blood vessels may tighten or spasm, and that's when the risk of stroke creeps in. A published study found that older adults who had contrast CTs were more likely to suffer vascular complications within 72 hours, especially if they had hypertension or kidney disease. Let me share a real story. An 81-year-old man had a routine CT scan. Everything looked fine, but 2 days later, he suffered a minor stroke. Doctors believe the dye temporarily spiked his blood pressure, causing a clot to form. This doesn't mean contrast CTs are bad. They can be life-saving. But they should be used wisely, not routinely. So what can you do? Ask, is this scan absolutely necessary? Tell your doctor about your blood pressure, heart health, and kidney history. Ask, can we do this without contrast? In some cases, an ultrasound or non-contrast CT is just as effective. Section 2. Stress tests. Next, the stress test or treadmill test. It sounds simple. Strap on a heart monitor, walk on a treadmill, and measure your heart under pressure. But for seniors, especially those with heart conditions, this test may be riskier than it seems. During the test, your heart rate and blood pressure surge. If your arteries are fragile or if you have high blood pressure, that sudden strain can trigger complications. These include dangerous spikes in blood pressure, irregular heartbeats, or in rare cases tiny vessel tears in the brain. A study from the American Journal of Cardiology followed 1,300 seniors. Nearly 7% experienced adverse events during stress testing, from heart rhythm issues to blood pressure spikes. Let me tell you about Margaret. She's 74 and had high blood pressure for years. Her doctor ordered a stress test just to check in. Midway through, she felt dizzy. The next day she suffered a minor stroke. Again, the test didn't directly cause it, but it added strain to an already fragile system. So, how do you protect yourself, or ask, is there a safer test for me? Consider a nuclear stress test uses medication, or a resting echocardiogram, and always discuss whether the test is truly necessary if you have no symptoms.
Section 3. Endoscopy with sedation. Let's move on to something even more common, the endoscopy. It's often done to check your stomach, colon, or esophagus, especially after 60. But when sedation is involved, the risks go up. Why? Because most seniors are on blood thinners, like warfarin or aspirin. When you're sedated, your blood pressure and circulation change. Combine that with thinner blood, and there's an increased risk of internal bleeding or even silent strokes. A major review in 2021 found that sedated endoscopies in patients over 65 were linked to an increase in or TIAs within 72 hours of the procedure. One patient, 76 years old, had a routine colonoscopy. She felt fine going in. 2 days later, she began slurring her speech and lost coordination. She'd had a mild stroke. The likely trigger: sedation, blood pressure drop, and daily aspirin use. So what should you ask? Do I truly need this test right now? Can we delay or use a lighter sedation? Do I need to pause my blood thinner? And always review your medication list with your doctor. Section 4. MRI with contrast. 10 o'clock to 13 o'clock. Next MR is with contrast dye. Powerful tool. Yes, but that dye often made with gadolinium can be risky if your kidneys aren't working at full strength. After 60, kidney function naturally declines, and gadolinium relies on healthy kidneys to flush it out. If it lingers, it can cause a rare condition called that affects connective tissue, skin, and even organ function. Worse research shows gadolinium can accumulate in the brain. Some patients report confusion, dizziness, and even balance problems afterward. In one 2019 study, 5% of seniors who had contrast misters reported stroke-like symptoms within a week. One case, Harold, 79, went in for back pain. He had an MRI with contrast. 2 days later, he felt weak, foggy, and dizzy. Turns out he had undiagnosed kidney disease. So what can you do? Ask. Can we skip the contract? Request a GFR tester, simple blood test to check kidney function. Tell your doctor if you've had reactions to imaging in the past. Only agree to contrast when it's absolutely needed.
Section 5. Carotid artery ultrasound. Finally, the carotid artery ultrasound. Non-invasive. No needles, no dyes. Just a scan of the blood vessels leading to your brain. Sounds harmless, right? But here's the twist. If you're not having symptoms, and your doctor orders this test just in case, it could steer you toward unnecessary surgery. Here's how it happens. The scan shows 50 to 60% narrowing in the artery. You feel fine. But the doctor refers you to a surgeon, and suddenly, you're being scheduled for a stent or surgery. But major research shows that if you have no symptoms, surgery might not reduce your stroke risk any more than medication and lifestyle changes. Worse, some patients actually suffered strokes from the surgery itself. Helen, 82, felt perfectly healthy. She had a carotid scan showed 65% narrowing. She underwent surgery and had a stroke during the procedure. So be careful. Ask, what are we trying to find with this scan? Will this change how we treat me? If you already take blood pressure and cholesterol meds, monitoring might be safer than surgery. And always get a second opinion before any vascular procedure. Final advice and wrap up. Let's bring it all together. Not every test is dangerous, but not every test is necessary, especially after 60. Your body is different now, more sensitive, more reactive, and what seems routine for others may quietly carry risks for you. That's why it's so important to ask questions, speak up, and make informed choices before any test. Ask, is this essential? Can we use a safer option? Does this truly serve my health right now? Because informed decisions lead to better outcomes and peace of mind. If you've ever felt strange after a test or scan, or seen a loved one experience something unexpected, drop a 1 in the comments. If not, drop a 0. Let's share, connect, and learn together. And if this video helped you feel more aware, more empowered, or just more curious, subscribe to Mindova. Because we're here to uncover what others won't, and to always put your well-being first.